Let me welcome to the show. He is, let me get your exact title so that we can be, okay. He is a vascular interventional radiologist at Houston Fibroids. Let me welcome to the show, Dr. Eric Hardee. Hi.
Hello. Hi.
Hi, Eric Hardee, Dr. Eric Hardee. Did your family start the Hardee's franchise? Is that in your family?
No, they did not. It was actually one of my great grand relatives was a general in the Civil War, and
Which
the guy
side?
I don't remember the guy who started the franchise. He actually taught at West Point. The guy who started the franchise was a Civil War historian, and so he named it after him. There was no relation to him whatsoever. So
Okay, all right.
did not start it. Tried to get
Okay.
free food when I was a kid, though, but never was able to. So
You should show them your ID. This is my family's restaurant. All right. How did you get into the fibroid area? You know, you had so many different disciplines you could have gone into. Why this area?
well, my specialty does minimally invasive procedures like angiograms, where we treat disease by inserting catheters into the body, doing angioplasty, things like that. And I started doing uterine fibroembolization approximately 20 years ago, and just was drawn to it because the procedure itself was technically very challenging, and I saw a need for it because it's a procedure that we do that treats uterine fibroid symptoms without surgeries. Because before this procedure was invented, basically, women's only option was to have major surgery, hysterectomy, where you remove the entire uterus, and this procedure came in as an alternative to getting rid of symptoms that are caused by fibroids without having to have surgery.
What are the symptoms that are caused by fibroids that they get this for?
Well, fibroids are benign tumors, and about 35 to 40% of women actually have symptoms. So most women don't have symptoms. And once you have symptoms, they usually get worse as time goes by. And the most common symptom is heavy bleeding, heavy menstrual cycles. The bleeding can be severe enough where women become anemic and need iron therapy all the time. Some women even need blood transfusions multiple times. I've treated women who had to have blood transfusions several times a year because of their heavy cycles. Fibroids can also cause a lot of pelvic pain or pressure. And if the fibroids or the uterus get big enough, they cause what we call bulk-related symptoms, where they'll press on structures like the bladder and make you feel like you have to go to the restroom, every 5 minutes. So that's kind of the most common symptoms.
Now, here's a strange story, and it's from 30 years ago. I had a friend who was pregnant, and she had fibroids that were bigger than her baby. And she did successfully deliver that baby with those fibroids. But she said the way they treated her, because she was in so much pain, was with morphine. And she said that morphine is not addictive if you actually need it. And so she was able to successfully deliver a baby and then treat the fibroids afterwards. Have you ever heard of any such thing? But
I have, and doing this 20 years, you really hear all the stories about what women with fibroids go through, and how much they suffer and how they're still able to get through and get on with life and get all their work done and take care of their family and everything. It's pretty amazing, actually, what women go through with fibroids.
And that's an XX chromosome.
Okay,
woman. You knew I was going to say it.
I'm imagining there's nobody with an XY chromosome that has fibroids.
Uterine fibroids.
Right. So let's
knowledge.
move that over here. Right. Dr. Eric Hardee is here.
Could I send my friend to you? Because she's scheduled to have her uterus taken out.
Well, fibroids is one reason for hysterectomy. There are also other reasons. So without knowing her history, I'm not really sure. There's other reasons for hysterectomy, including uterine prolapse, where the uterus sort of kind of sags out the bottom of the pelvis. Also, endometriosis is a common cause of hysterectomy.
She has the symptoms. She's keeping her ovaries, but they're going to take the uterus because of all the fibroids.
Right. So, and fibroids is fibroids is the most common diagnosis for African-American women to have a hysterectomy. About 68% of African-American women, if they have a hysterectomy, it's due to fibroids. It's the most common diagnosis there. And, hysterectomy gets rid of the problem, but, it's a major surgery. You have to have a permanent scar. The downtime is typically, most women are quoted 4 to 6 weeks of downtime, sometimes more, sometimes a little less. These minimally invasive hysterectomies where you do it laparoscopically really can't be performed in most patients with fibroids, because fibroids are large masses that grow. And once the uterus gets to be, a certain size, you can't remove it laparoscopically or transvaginally. It has to be removed from an open abdominal incision. So that's what makes it a bigger operation.
So Dr. Eric Hardee is here. Vascular interventional radiology is what he specializes in, which is what, cutting off the blood supply. And is that so? What's the process by which you deal with fibroids? And I know a lot of Black women that have them. The bleeding, the excessive bleeding every month, the pain is the anemia, all of those things. Which right now in COVID, having that is almost puts you in an immunocompromised. It probably does, right? To have anemia during a time when we're in a pandemic is not good.
No, it's not. And a lot of women are walking out there being profoundly anemic, and they can cause, extreme fatigue and health issues. So, how the procedure works is, if a lady has symptoms, typically they'll get an imaging study like an ultrasound in their doctor's office, and they'll detect fibroids. And then women who sometimes are referred to us by gynecologists, oftentimes they find us doing their own research on the internet, and they're looking for alternatives to hysterectomy. And we will see the patient, and then once they're evaluated by us, we'll order an MRI imaging study to look at the fibroids and see how many there are, where they're located. We want to check the blood supply. Fibroids are very vascular tumors. The way the procedure works is you shut the blood flow down to the fibroids. And once the fibroids are deprived of their blood supply, they begin to shrivel up. They shrink typically to about 30% of their original size. But in addition to shrinking, they soften up and they turn from like a hard, solid rubber mass into like a little water balloon, like a little cyst, where you no longer can feel it because they're so soft. But most important, though, is that in addition to shrinking and softening, the symptoms go away. Typically, heavy bleeding symptoms are gone in over 80% of women at the 3-month interval, and at the 12-month interval, in over 90% of women, the bleeding symptoms are gone. Bulk-related symptoms, say you got a big fibroid pressing on your bladder, causing a lot of urinary frequency, those can take a little bit longer to go away. Typically, at 3 months after the procedure, 2/3 of women have relief of symptoms, but at 1 year, over 90%, the bulk-related symptoms are gone as well. And the advantage of the procedure is there's no scars, there's no incision made in the body. We insert a very tiny catheter into the body to do arteriogram. The catheters are so tiny nowadays that I actually inserted, and my partner and I have been doing this for a while. We inserted through an artery in the left wrist, and then guide the catheter into the pelvis and do an angiogram, find the blood vessels.
Wait, from the wrist, from a person's wrist, you insert a catheter that goes all the way down to
all the way
uterus.
down.
Wow.
Takes about 90 seconds to get there. And the advantage of the wrist access is kind of a side thing, is that the bleeding complications are lower. As soon as we're done, the ladies can get up and walk around. Typically, most arteriogram type procedures are done by inserting a catheter through an artery in the groin. And if you have that, you have to lay flat for several hours afterwards. But doing it through the wrist makes the procedure easier for us, makes it easier for the patients, fewer complications. So we insert the catheter down into the pelvis, and this is all done with X-ray guidance. We're looking at, under fluoroscopy or X-ray, live X-ray basically. And we inject, X-ray dye and map out the blood vessels in the pelvis and find the blood vessels that are feeding the fibroids, and inject these tiny inert particles. They're made out of a kind of a collagen-based substance, which is a naturally occurring substance that's in everybody's, body and tissues. And when these little tiny beads are about 0.5 millimeter in diameter, we float those into the blood vessels supplying the fibroids and shut the blood flow down on the fibroids. And once we have all the blood flow shut down to each and every fibroid, then the catheter comes out and the ladies go home about 1.5 hours after we're done. There's no scar, no stitches. We don't remove any body parts. Ladies recover in their own home. Most patients are back to starting to resume normal activity and go back to work around 7 days after the procedure. Some go back a few days earlier.
Who
Some go back a few days. Say again?
Who invented this?
It was really these two French physicians. One was an interventional radiologist. The other was a gynecologist, Pelage and Ravenna. And this was in the early 90s. They had a group of patients, and the gynecologist was concerned about blood loss in this large group of patients. And so he asked his colleague in the hospital, who's an interventional radiologist, to embolize or shut the blood flow down in the uterine arteries, supplying the uterus before surgery. And so for some reason, which is not entirely clear, a large group of patients, a somewhat large group of patients, was they had their embolization procedures done by all at once, and there was a delay in them getting their hysterectomies. And then a few weeks later, all of the patients started canceling the hysterectomies, calling up saying, my symptoms went away, I don't want surgery anymore. And so that's when people, hey, maybe we're onto something here. And then other people started studying the procedure, in Europe. And then a few years later, it started being performed in investigational trials at medical centers in the United States. And this was right after, it kind of passed the kind of research phase, is when I was a fellow in Oregon, and one of my young attending professors was this was an area of interest for him, and I started working with him, and then I've been doing it since then. And since then, it's been researched more heavily. It's becoming more widespread, although a lot of people still aren't aware of it. 20 years in medicine is still relatively new. When you're talking about supplanting surgical procedure, which has been around for 80 to 100 years kind of deal. So
are the most of your patients Black women?
I would say 2/3 of them Black women, and then the next the other third are a mix between Caucasian and Hispanic women. But fibroids are 3 times more common. Fibroids are common in all women. Okay, by the age of 50, 70% of Caucasian women will have fibroids. 80% of African American women will have fibroids. African American women are more likely to have larger fibroids and be more symptomatic. So if you look at hysterectomy rates, only for Caucasian women getting hysterectomy, only 1/3 of them are getting hysterectomy for fibroids. The most common cause for hysterectomy in Caucasian women are things like uterine prolapse or endometriosis. Okay, so only 1/3 of hysterectomies Caucasian women done for fibroids. In African American women, almost 70% are done for fibroids. If you have a hysterectomy as an African American woman, 68 to 70% of those women are getting it for fibroids. And if you look at hysterectomy rate per 1,000 women, the hysterectomy rate per 1,000 women for Caucasian women is around 5.5. So out of 1,000 Caucasian women, a little over 5 out of 1,000 will have a hysterectomy for any reason. If you look at African American women, same age group, we're talking 35 to 44-year-olds. If you look at African American women, out of 1,000 African American women, over 12 will have hysterectomy for fibroids alone. And so then you add other causes in there, and the hysterectomy rate in African American women is more than double any other race, and it's primarily due because of fibroids.
Do you also think that there could be some medical bias in terms of, like, because your procedure seems to be effective, and why isn't that the most prevalent way in which we treat fibroids? Why take out?
I think there's a number of reasons for that. I think that by and large, as the medical community is so super specialized. It's very difficult for I'm extremely specialized, and there's things that I hear about other people doing in other specialties, say, oh, wow, I didn't know you could do that. It's hard to keep up when you're so focused. And then other things, doctors may know about this procedure or they may not know about it. If they know about it, even if they know about this procedure exists, I think it's a natural, it's a tendency. If you're a physician and a patient comes to you with a problem, you really want to help that patient. You want to treat that patient. You want to help them solve their problem. The natural tendency is to look inside your own toolbox, to solve that problem, not going to look into somebody else's toolbox. And gynecologists don't do this procedure, and they're trained to do, surgery. And so, when somebody comes to see them, the natural reaction is to, treat patients the way they're trained to treat patients. And, you can't.
If you're a carpenter, everything looks like a nail.
That's right.
Right,
And so
right.
And they don't really do anything remotely similar to this.
So we need more Dr. Hardees in the world. And I'm only rushing you a little bit because we only have like 5 minutes left, and we have a bunch of people who want to ask questions.
So what's the name of your specialty, so we know what people need to go into?
Interventional radiology, vascular interventional radiology.
Okay. All right. Let's go to Lonnie in Atlanta. You have a question for Dr. Hardee. Welcome.
Yes, thank you. So with my fibroids, I never had the heavy menstrual, all that. Never, was always light, little cramps, not. And then when I turned 50, I was like, I'm gonna start exercising. I had pain in my belly. is fibroids. I started menopause that same time. The fibroids. I mean, like I said, I might have had them, but they just started then.
So you think you activated them by? I've heard the
Yeah,
opposite,
no.
Dr. Hardee. That
Yes,
menopause can shrink.
Typically at menopause, the symptoms get better. Not always, but they typically get better. And so, when you're getting in your 50s, that's when you got to, kind of decide, are your symptoms, getting worse or getting better. And that's important to see a gynecologist for that, because they have to do a pap smear and endometrial biopsy. If you're not having any bleeding, you can still have bulk related symptoms from fibroids even after you stop having menstrual cycles. And so some women are still symptomatic after menopause due to fibroids because of that.
Deborah, and thank you for sharing, Lonnie. Deborah in South Carolina, you're on. Welcome.
Well, thank you. I had the procedure done. I'm in South Carolina and was scheduled to have the pre-op was scheduling it. And a friend of mine called and said, I had this procedure done. I don't want you to go through the hysterectomy. And so long story short, I canceled the procedure, the hysterectomy. Shout out to Roper Hospital in Charleston. Found the specialist there. Got the procedure done back in 2014. I developed pica. I was eating ice like crazy. Haven't had any problems since. I'm 60 now, and didn't go through menopause. It was wonderful.
That's great. That's great.
And
And the ice craving is a very common symptom when you have iron deficiency anemia. Many women bleed so heavily, they have iron deficiency anemia, and craving ice and brittle hair and other things are kind of secondary, kind of indirect signs that you have anemia.
Interesting. Cynthia in Ohio, you're on. Welcome.
Hi. I was just calling to say the exact same thing, that I had the procedure also about 4 years ago, and had to, decide between a hysterectomy or this procedure. And I knew I didn't want to get a hysterectomy. I had an African-American OBGYN, and that's what she recommended me to do. And hey, it's been wonderful. So
Where are
I just
you?
wanted to
Where'd you do it?
I'm in Columbus, Ohio. My doctor was Dr. T, Black OBGYN here in Columbus, Ohio.
Okay, so we got to encourage more OBGYNs to know either to have somebody working hand in hand like Dr. Hardee, who is a specialist in vascular interventional radiology, which I think is amazing. That non-invasive, and that you can go through the wrist. What? How much does diet, fat? I was, all tumors feed on fat, from what I heard. So if you have a low fat diet, or if you eliminate fried foods from your diet, will that impact the size of your fibroids?
That's an excellent question. First off, not specific foods, but to start with is obesity. Being overweight increases your relative risk of having fibroids and having larger fibroids. Adipose tissue increases the conversion of hormones, and you have more estrogen. It's basically hormones are converted into estrogen in fat cells. And so being overweight contributes to it. But specific types of food also are known to increase the risk of developing fibroids. Beef, eating a lot of red meat increases your relative risk 1.7 times. Ham as well. Consuming mainly a vegetarian diet lowers your risk. So diet does definitely play a role in it, in addition to your overall level of health and weight.